Today I will introduce APOLEX Tite. APOLEX Tite is effective for double chin, nasolabial folds, and marionette lines. When combined with liposuction, fat can be melted first and then removed, making the procedure easier and results smoother. I use APOLEX Tite more frequently in Japan than in Korea. Out of about 40 clinics I operate, 20 are equipped with this device, performing an average of 1 to 5 cases per day. Today I will focus on nasolabial folds and marionette lines. APOLEX Tite targets the subcutaneous fat layer. It delivers thermal energy to contract tissue and stimulate collagen regeneration. It also directly dissolves fat, achieving both volume reduction and tightening. In the past, devices that melted and suctioned fat simultaneously had issues such as thermal damage. APOLEX Tite compensates for these limitations, allowing for safer procedures. The most important factor during the procedure is setting the target layer. Treatment is performed focusing on fat compartments and the superficial fat layer. Unlike external energy delivery, APOLEX Tite delivers energy directly from within. RF energy generates heat through tissue resistance. Excessive heat may cause tissue damage, so proper control is essential. For fat lipolysis, sufficient tumescent solution must be injected. This ensures even heat distribution and a more stable procedure. On the other hand, for tightening, a relatively smaller amount of tumescent is recommended. As the procedure progresses, fat gradually dissolves. At this point, tissue resistance felt by hand gradually decreases. The endpoint is determined when resistance disappears. Once the fat is sufficiently dissolved, it can be easily removed with simple suction. With conventional suction alone, there tends to be more bleeding and results may be uneven. However, APOLEX Tite reduces bleeding and provides more uniform results. It also minimizes irregularities and provides a skin tightening effect. If the amount of fat to be removed is small, hyaluronidase can be used. It helps reduce swelling and facilitates faster drainage. Alternatively, light compression can be applied to induce drainage. When fat is sufficiently dissolved, about 1 minute of suction is enough for removal. Before the procedure, sufficient anesthesia is performed using tumescent solution. This reduces pain and allows for a more stable procedure. The tumescent solution consists of saline and lidocaine. Epinephrine may be added to reduce bleeding. Tranexamic acid may also be used to minimize bruising. The solution should be evenly injected throughout the treatment area. This ensures even heat delivery and stable treatment outcomes. After injection, treatment is performed when the tissue is sufficiently expanded. The amount of tumescent varies depending on the treatment area. For double chin, about 100 to 200 is used. For the neck or small areas, 10 to 50 is used. APOLEX Tite is equipped with a real-time temperature sensor that automatically stops output if the set temperature is exceeded. This allows for a safer procedure. Collagen production is most active between 42 and 45 degrees Celsius. APOLEX Tite is typically set between 40 and 50 degrees Celsius. Up to 50 degrees may be used depending on the area. For sensitive areas, around 40 degrees is sufficient. The cannula should be moved slowly during the procedure. This ensures even heat delivery and uniform fat dissolution. Results become more noticeable as swelling subsides within 2 to 4 weeks. I consider APOLEX Tite to be a very useful device. It offers high usability compared to its cost. Maintenance cost is low due to minimal consumables. It has also shown good results in under-eye fat treatment. Studies have reported safe and effective facial contouring outcomes. Above all, safety is the most important factor. Safety should always be prioritized over results. In the early stage, 1 to 2 sessions are recommended. The device allows real-time temperature monitoring and is typically set between 40 and 50 degrees. Power is usually set between 30 and 40 watts. It automatically stops when temperature rises or impedance is detected. Green indicates standby, blue indicates output, and red indicates automatic stop. For double chin, the procedure takes about 7 to 10 minutes. For marionette lines and lower face, tightening provides contour improvement and volume reduction. Thank you.